Hi, I'm Brittany Lowery and I'm an MPH student at Oklahoma State University. The purpose of this presentation is to explain two types of epidemiological studies, case control study and cohort. The studies in which I will be discussing today are investigating similar topics, healthcare utilization outcomes associated with comorbidity of schizophrenia and cardiovascular disease. These studies can be described as such. Case control studies examine exposures in relation to a disease or health outcome. Participants are defined as case, those exposed, and controls, those unexposed. Exposure histories of the participants and the subsequent health outcomes are compared. Cohort studies, on the other hand, examine various health effects of an exposure, and the participants are defined according to the type or level of exposure. Cohorts are followed throughout time and disease occurrence or another outcome is recorded. There are both retrospective and prospective cohort studies. In the cases I will be discussing today, both aim to discover the differences in cardiovascular events and subsequent health services or hospitalizations between those patients with schizophrenia and those without. Looking at the case control study first, the overall purpose of this study was to investigate the healthcare utilization of people with comorbidity of schizophrenia and cardiovascular disease. In this particular case control study, a diagnosis of schizophrenia is considered the exposure, and the outcomes measured are the differences in drug utilization, laboratory tests, specialist visits, and surgical intervention, which are identified and compared between each of the groups, the case group and the control group. This study and others like it inform health officials of gaps in cardiovascular care between populations with schizophrenia and those without. Now, looking at the cohort study, the purpose of this study was to estimate the excess risk of hospital admissions for cardiovascular events in schizophrenic patients. In this particular study, a large group of people, some with a diagnosis of schizophrenia and some without, were followed for a number of years. Incidences of cardiovascular-related hospitalizations were recorded and compared between both groups. This study and others like it could inform health officials of differences in access to treatment and preventative care for those with a diagnosis of schizophrenia compared to those without a diagnosis. If you would like more information on either one of these studies I've discussed today or their results, you can find links to them listed on the reference slide of this presentation. Thank you.